How you doing today, ma'am?
When you arrive on scene, note any clues on the scene that might suggest the patient is diabetic.
Says you're diabetic. Okay. Are these your medicines?
Yeah.
It's actually sometimes very difficult to diagnose someone who is a diabetic. It can be very helpful if you have clues on the scene, such as a medic alert tag, evidence of diabetes medications, syringes, insulin vials, sharps containers to dispose of syringes. Those sorts of things will be pretty good clues.
Did you take them today?
Quickly evaluate the patient's appearance. Look for pale skin, nausea, or signs of confusion.
Did you find her like this?
Ask specific questions about the patient's symptoms. Determine whether the patient has noticed recent changes in appetite, thirst, or need to urinate.
Polyuria is where they're going to the bathroom a lot. They're going and urinating a lot. And then with polydipsia, they want to drink. They want to drink lots of fluids. And with polyphagia, they feel hungry. Even though their blood sugar might be really, really high, these patients aren't getting the sugar inside the cells where it needs to be. And the cells are actually starting to starve. And so it sends a signal to the brain telling the person that they want to eat something, even though they have a lot of sugar in their blood.
Use a glucometer to monitor the patient's blood glucose. A glucometer provides essential information for making treatment decisions. Look for other conditions that might be causing the patient's symptoms, such as an infection, stroke, or kidney failure. Consider whether diabetes might be a factor when working with a patient who exhibits any altered mental state.
We had a situation where the crew was called to take care of a patient who was being combative, and police had called us to the scene to take care of them. And they expressed to us that they believed the patient was intoxicated. And as we got there and we started assessing this patient, it just didn't quite seem right. It wasn't the right time of day. It wasn't the right situation. It just none of this, they're intoxicated, seemed to really line up correctly. But we did have someone who had an altered mental status. And so as part of our normal routine care for this patient, we went ahead and tested their blood sugar, and we found out that it was in the 60s. And so, of course, once we treated them with some glucose, they responded fine. They came back to a normal mental status, and everything worked out okay.